My name is Stief Lea. I am 57 years old. I'm a physiotherapist and I worked for Extramural for 26 years. And I also have a private clinic here at my home. And I've been promoting health all my life, all my 36-year career. Havelock is actually where my ancestors came to. We've been here for over 200 years. Our dream was to come and build a house here. It's our haven. It's just where we want to be, and we're back in my community. It's a dream to actually live here. I try to, help out the community and all the lovely people here, because a lot of them I've known all my life, but there's also lots of newcomers, and I just think it's the best place to live for our family, and it was a great place to bring our children up.
We've been brought up to value community, and that's why she wants to get her word out because of radon, and just making sure that everyone knows it could happen to anybody. She's got the healthiest lifestyle out there.
I used to go to the Lung Association, used to put on a yearly education day, and I went to several of those, and I first learned about radon and that it was quite bad in New Brunswick then. But I didn't test right away. It's important not to hide the fact that we have radon. Probably 4 or 5 years ago, we actually tested for radon, and it was high at the time with the numbers that we had at the time. We knew it was about 18 times higher than it should be. We should have done more at the time, and it's not even relatively inexpensive to actually, mitigate the risks. But what I really feel bad about is my children's playroom was in the basement, and they spent all their years down there playing. Hopefully they're not at risk. My husband's had a chest x-ray, so far so good. Soon it'll be safe to go in. Whether it changes things for me, it's okay. At least the house will be safe for whoever. We just need to know. We need to know about New Brunswick. We need to know, especially this area, and there's other areas that are, I think about my patients and kind of where they come from, and that some of them are at risk because of where they live too, and all of New Brunswick is not great. As long as the word gets out and people start testing, and then the big deal is, the mitigation required after you test, because testing is great, but there's got to be some type of funds to actually help with mitigation. If you get it done, like, you're doing something for your health, so that should be able to be on your taxes, that should be able to be claimed as a health expense. I mean, we need to get people tested first, and then we need to, get the work done, whatever way that is going to happen. And we're going to need all levels of government probably to look after that. It's been work that the Lung Association and Health Canada and, other people have been doing for ages. And, now it's really close to home for me. My biggest asks would be test for free. I just think about, my tax dollars. I live in a beautiful house that we built from the ground up, and, you're losing me from the system probably, and my tax dollars, and, for the cost of testing and mitigation, it's almost a no-brainer to me. We need to think about that. If we're talking about energy retrofits and we're making houses tighter, why would we not make them safe and tight? And we can. It's not an impossible thing. With the number of houses affected in New Brunswick, I think the estimates are 1 in 4. It's our health. We're New Brunswickers. We need that. So, from the radon point of view, that, would be that it's not going to be a burden for anybody to actually test their homes and get the fixes done. For my life, seems like a small ask. It is a beautiful province. I love New Brunswick. I'm here because I love it. I love rural New Brunswick. But right now, like, the area is, has got this hidden danger, this odorless, colorless, tasteless gas that's seeping up, and so many people I've mentioned it to, they've never even heard of it. And I was lucky I had heard of it, and I was fairly well educated on it, but I didn't do a good enough job, or we didn't do a good enough job. This is just a little thing, really, in the big picture. New Brunswickers they're good people. I really do believe, for the most part, we're really good people, and I think it's just that not everybody's informed. I just want people to donate to the Lung Association. Because, they're always there doing good things from way back in TB times, and they're a nonprofit, charitable organization, so your donations, they haven't asked me to say this, but they just go to such a good cause. And like I said, not just on the radon front, but all fronts. Anybody with lung disease, they're always advocates, and I think that's so important, and you can't get enough word out for. I think of all the COPD patients I've had, and all the different patients with like pulmonary fibrosis and different lung diseases I've treated over the years, and not being able to breathe is a real. It's when you can breathe, you got a real right in life, and you know, lung transplant patients and all kinds of people that they support, and their education. So that's what I would say. Just support them if you can, and your money's going to a good cause. So.